Macias,
Present.
Leandra Clark Harvey,
Here.
Isabel Jerome,
Here.
Elena Flowers,
Present.
Vito Bassiani,
Here.
Pat Levitt,
Here.
Linda Malkus, Chris Miaskowski,
Present.
Yael White, and
Linda
one more time.
here, sorry.
Yeah. Gotcha, Linda. Thank you very much. Great. We have a quorum. Thank you very much, Isabel.
Very good. Thanks, Scott. Well, without further ado, let me invite Amy Adams, our Senior Director of Communications, to take the mic and share the plan. Amy.
Thank you so much, Isabel. I wanted to start this meeting by introducing the rest of the communications and outreach team. I think many of you know these nice people, but for the last few meetings, it's been a lot of me babbling away about my communication strategies, and I just want to make sure everyone knows all the people who are doing the important and amazing work. So if you guys could kind of wave when I say your names. Esteban Cortez, Katie Sharifi, Christina Smith, that's the communications team, and then Aditi Desai runs our outreach. And not present here, but critically important to our team, we've got two contractors, one who works with the communications team, and that's Holly McCormick, and one who works with Aditi on the outreach team, and that is Jacqueline Hankin. And they're both very important to our work. So thank you to this entire team. And sorry that you have to listen to me babble away again, guys.
As long as it's good babbling.
That's good babbling. Before I start, there was a really incredible piece today in the World Economic Forum about the importance of emotion and storytelling in describing science to the public. It takes emotion and storytelling to make the hard facts memorable. Okay, we've got a few people who also saw it. I would love to forward that to any of you who did not see it, and maybe Scott or Claudette could help me with that task. It's such an important piece, and I think really, if someone could write a piece that advocates for my emotional strategy, then it would be this one. So I think it's really wonderful. Okay, and now I'll start with my actual presentation. So let me take a minute to bring up my screen. Okay, so you should all be seeing my presentation in presenter mode. Some members of the subcommittee, CIRM staff who are present, and any members of the public who are listening in, it's really a thrill for me to present my communication strategy today. This strategy is going to guide the work of the team for the coming years. This presentation is a slightly abbreviated version of the full strategy, which you can find linked to the agenda. And I'm welcome, if I don't cover anything in this talk that you see in the agenda, I'm happy to take questions, or you can follow up with me by email later. My screen is not advancing if you're wondering why I'm pausing. Here we go. All right, the mission slide. First, CIRM's mission, and I know you see this slide a lot, but you see it a lot because it really does guide absolutely everything that we do, and that is the need to provide therapies to people in California and the world. And this is the communications and outreach mission, which I'm going to start including in presentations. And you saw this at the last meeting. Our mission is driving awareness of and support for CIRM's progress and accomplishments. How, you may ask, are we going to do that? That is what the rest of this talk is about. So this is the agenda. So today I'll talk you through the objectives and metrics. We'll talk about the strategy and tactics, and I'll give you a timeline for implementation. First, let's talk about objectives and metrics. So these are objectives that you saw at the last meeting. And at that meeting, I showed how each of these objectives ladders up to goals of the SAF and to CIRM's ability to achieve our mission. I'm not going to walk you through all of that today. If you want a reminder of why I chose these objectives and how I think they ladder up to the SAF and CIRM's mission, you're welcome to reach out to me, or you can go back and watch that last presentation. These objectives align with audiences that are critical for CIRM's success: the California public, patients and patient advocates, lawmakers, and scientists. And we have a fifth additional objective focused around our own team's efficiency because we have a lot to do. And then my standard disclaimer here is that I'm fully aware that the California public is not one audience, but the ways we reach the California public are not always very narrow. So I consider them as one audience. And when we are talking to narrower audiences, we of course can refine our messaging. So now I'm going to walk you through each of those objectives and talk about how we are going to measure whether or not we are reaching those objectives. So the first is around the California public. And just as a reminder, the full objective is phrased increase support for CIRM among the California public, but I don't have room for all that on this slide, so I'm just saying California public. The California public matters because they created CIRM. Their money pays for our work. In the current environment, we also want people to see the value of funding for scientific research. To track our success in reaching this audience, we'll measure engagement on social media platforms focused on the general public. These are primarily Instagram and Facebook. We'll also look at sentiments in surveys and focus groups, and we'll track community groups who request CIRM speakers or involvement, because if a group asks to hear from us, it means they're aware of us and interested in our work. Lawmakers. Okay, the full language of this objective is increase support for CIRM among lawmakers. Lawmakers are critical for CIRM success because they support our activities and policy proposals, and they act as advocates for us to their constituents. We'll measure our success in reaching lawmakers by tracking whether they mention us on social media or in other public forums, and by whether they actively engage with us and support our policies. And at this point, I want to pause and say, my team can achieve absolutely none of our objectives without deep, deep collaboration with people across the organization. So in this case, we all know our vice chair, Maria Bonneville, has been actively involved in doing outreach to lawmakers, and collaboration with her is absolutely critical for us to achieve this goal as a group, which includes Maria. Scientists and industry. The full language of this objective is position CIRM as a leader in driving discoveries towards therapies. We need scientists and industry members to see CIRM as a regenerative medicine leader because we want them to partner with CIRM, apply for funding, and serve as advocates. We'll measure our success in reaching this audience by tracking how often scientific meetings ask for CIRM speakers, tracking engagement on social media platforms intended for scientific audiences, such as LinkedIn and X, and by how often grantees or applicants reach out to us with questions or concerns. If we are fully meeting their needs, they might have fewer concerns. Patients and patient advocates. The full language of this objective is increase support for CIRM's accessibility programs among patients and patient advocates. We want patients and patient advocates to participate in clinical trials and advocate for others in their communities to participate. We'll measure our success in building awareness in this community by tracking the number of advocacy groups who request CIRM participation in their events, and by tracking the number of people who reach out to us wanting information about CIRM clinical trials or how to access them. Finally, efficiency. Our team needs to be efficient if we're going to achieve these goals and meet internal needs of the organization. And one thing for you to know, we talk a lot about the big external public who we need to reach. The communications team also serves a vital role within the organization, maintaining the website and helping with all communications that come out of all teams. So it's a lot of work. We'll measure our success by tracking whether all of our activities are focused on communications objectives. And we'll want to see a decrease over time in activities not focused on our objectives. We'll also measure whether the support we provide other CIRM teams directly maps to their objectives. So really, in cases where we're serving as almost a service agency, are we making sure other teams are meeting their objectives too? Okay, how, you ask, are we going to achieve all of these objectives? And that is where the strategy and tactics come in. Wait, this is a build. Okay. You might all recognize this slide from the last presentation I did to the board. I told you that I want everyone in CIRM to be singing the same song, and that song will translate into storytelling for 4 key audiences across California. And I said I wanted to create a song that inspires these emotions, which I believe are critical for achieving the objectives I laid out. If we can stir these emotions, we can inspire the public, patients, lawmakers, and scientists. Well, this slide is essentially my strategy. Only I'm going to show it like this from now on. These are the 4 pillars of my strategy: create the story, tell the story, deliver the story, and measure the impact. And now I'm going to walk you through each of these pillars and what we're going to do within each pillar. Create the story. Our story needs to connect emotionally with the people we are trying to reach. It needs to be flexible enough to be told by anyone to any audience. I've hired an agency called Valspring to help create this story, and I'll be debuting that story at the full board meeting next week, so stay tuned. We'll also create alternate versions of the story with proof points, and we plan to create a progress tracker so people can see our progress. Tell the story. The story doesn't help us if we think the story doesn't help us if we don't do anything with it. We plan to incorporate the story into diverse storytelling formats, including patient stories, scientific progress, and videos. We'll create a content strategy that takes into account which audiences each story format is intended for. We'll also develop a cool toolkit to help CIRM staff, board members, and others easily tell the story. And we need to finalize website accessibility so that everyone with every level of vision can access the information. Deliver the story. Achieving our objectives depend on being able to deliver emotionally resonant stories to the right audiences. To do this, we first need to be sure we've got robust channels and processes to reach each audience. We'll train staff and board members on how to use the storytelling toolkit and use it to deliver CIRM story. We'll create programs to better leverage patient advocates and to better reach grantees and applicants. Finally, and importantly, I've hired a PR firm. We hired a firm called Forsmarsh, which has a national reputation as an agency focused on public good. In particular, they've worked with several institutes within the NIH, as well as the CDC, and national patient advocacy groups. They recently helped us pitch the announcement of the Community Care Centers of Excellence and gave us widespread media placements, including, and I'm very proud of this one, Rosa did an interview on Spanish language radio. I'm so glad we have someone in Rosa's position who's able to speak Spanish so well. I'll have more to say about that work at next week's board meeting. And finally, you can't change what you don't measure. Critically, we need to know what the people of California know and think about us. We'll be hiring an agency to carry out focus groups or surveys. We'll also start providing regular metrics reports showing our progress, including media placements, social media engagement, website traffic, and other measurements. We'll report out on these metrics and revise our strategy yearly as needed. And finally, how long is all this going to take? So this is a vastly reduced version of the timeline, and you can see the full timeline in the document attached to the board meeting. There's not room on the slide for all the things we're going to do. I do want to note a few things. We are working on a storytelling toolkit, and I expect to have that finished next quarter and to begin training in the late spring. And this is a toolkit that I specifically want to make sure all board members are comfortable with, because you are among our greatest advocates. We'll begin providing metrics in the new year. And we're going to start the surveys and focus groups at the beginning of the next fiscal year for reasons that are probably obvious, and that is that we need money to carry those out. But we have already identified a vendor who I think is excellent. There might be more out there. And I also welcome recommendations on that one. Okay, and with that, thank you all very much. And I would love to take questions. And I'm going to stop screen sharing so we can all see each other for the questions.
Okay, does anybody out there have some questions? Did I see somebody raise a hand? I guess Scott can help me with Maria.
I don't have a question, but I wanted to thank Amy and the team for this presentation. And I wanted to thank Rosa. Amy asked me if I wanted to do it in Spanish, and I all of a sudden got very nervous with my Spanish skills. And I said, no, I think it's Rosa. And Rosa was interviewed, and she did a fantastic job. So, being able to do these interviews in different languages is really important. And I promised Amy I would practice more of my Spanish, science Spanish, to help.
Maria, we didn't talk about this earlier, but we're starting to line up a media training session for you with the Spanish-speaking media trainer that Rosa.
Amazing. Thank you. Okay.
Well, anybody else have any questions? Please feel free. Marguerite, do I?
Pat Levitt?
Pat, sorry, Pat. Go ahead.
Okay. So Amy, great. And, strategy tactics. I love the strategy of using strategies and tactics. The one thing I needed more clarity on is the order of the activities on your timeline. Because the focus groups, which give you some sense of piloting the stories, is coming at last in the order of the various activities that you have, rather than one of the first things that you do. So why did you select that order of activities? If the stories resonate, you're all set. If they don't resonate, then you have to go back to square one and figure out how to modify them. And because you have various audiences, as you say, you're going to have to take the same core story and then modify it in ways that are going to resonate with the various groups.
Yeah, Pat, I mean, you're exactly right. I would love to do the focus groups first. And the reason I'm not is just very straightforward. I took this job after the budget had been set. And the focus groups the vendors I looked at who run focus groups, the ones that are good are not cheap, and I want to use a good one. So I'm waiting for the fiscal year. But in the meantime, we actually have a lot of information. Christina is off screen right now, but she monitors our metrics around social media, our blog, our website. We actually get really good information about what's resonating and what's not. So as we start rolling things out, we will get early indications of what is or is not resonating. So it's not like we're flying blind, making up content. We will have information, and then starting next year, we'll have great information. But I think you're right. It's just you gotta plan.
Okay.
Yeah, but
So
you're not wrong.
yeah, and Amy, as follow-up though, I just happened to hone in on Facebook today and presence, and I was kind of astoundingly surprised at the variety and the presenters and the stories that I did see there. So I appreciated that. Can you give us any update about whether or not, since you started to shift on the emphasis and started to shift on communication strategies, are we seeing an uptick in our different social media, just generally?
Isabel, could I answer that question ask it again at the full board meeting, and that'll give me time to have a conversation with Christina, and we can put something together for you. Is that okay?
Yeah, I think so. But and the other thing about that is related to each of those social media. Who are those visitors to those different pages? And therefore, how do we target, not my favorite word, but how do we, turn a lens on their need to know and how they need to know so that we can focus on that. But I want to go to Marguerite. I have another question for you. I'm sorry if I don't see anybody else's hand, but I'll go to Marguerite right now.
Thank you, Isabel. And oh my gosh, thank you, Amy. This is just tremendous work. I was at the last meeting, although I wasn't officially a member at that point, so it's a little, I'm still pretty new to all this, is what I think what I'm saying. And I'm pretty impressed when you introduced your team here at the beginning. There's not too many of you. This is a lot of work. So
I mean, I don't want to complain, but yeah.
yeah. So yeah, and I was kind of curious about that. There's a lot of, I used to run measurement stuff, so there's a lot of measurement here, which is great. Do you guys have all the tools that you need to be measuring things like, which lawmakers are engaging on social media? And yeah, tell me a little bit about that.
Yeah. Okay. So the lawmakers, those metrics are, if you go back and look at, I can show the slide again, or you can go back and look at the document. The metrics around lawmakers are a little squishy because it's going to be hard to measure. Every time a lawmaker goes on social media and says something about regenerative medicine, if they don't tag us, we don't see it. Yeah. So the lawmaker metrics are squishy. I'm looking at Maria right now.
Yeah, Amy, do you want me to add a couple things?
Yeah, please go right ahead.
Yeah. Something that we're trying to pull together, Marguerite, and it's an ongoing project, is as we visit with more lawmakers in Sacramento and at the federal level, is connecting with their comms folks so that we can do, if we run a story perhaps about a patient that's being treated in their district, or a high school student who goes to one of our training programs or something to that effect, we can tag them in the post, and then they can also use it and reciprocally tag us as well in their outreach to their own communities. So that's going to be a continued effort, and that's not easy, but it's something that we're gonna continue to do.
I think that's a great idea, and I totally get it that it's not easy, and yeah, it will be hard to gather all that. But you're looking for trends, right? So hopefully things will be building in the right direction. But yeah, I want to just wish you all a whole lot of luck with that. And just something that struck me, because as I was reading through the full document, I think I read something yesterday or recently about how even if and I'm looking right now at the challenges among that objective 4, that CIRM has no approved therapies in the market, making it harder to generate enthusiasm. And this point was about, proving a hypothesis wrong is also learning something. And I think there's a whole, but what I'm realizing in the stem cell field is there's so much to learn that's wrong that's going to then lead you to the right places. So I know that's not an easy message, but it resonated with me, so I wanted to say it out loud.
I think it's true. I think it's also, a challenge is also an opportunity, right? It is one of our challenges. And if we don't address it well, it can be a hard challenge. But I also think we have great stories to tell that help us overcome that challenge. And I think that's where we're going to focus. I just wanted to be honest about what the challenges were, and about how we're going to try to overcome them.
So Amy, I've always been concerned about the budget for communications, and very positive about moving it right next door to the president's office, because I believe that everything emanates from communications. If you don't get it right, California doesn't get it right. And so I'm not sure what you're planning or pending when you're saying we have a new budget year, but certainly we should, JT, consider, given the heavy lift we're asking people, and given we're concerned about the sustainability, a new initiative or whatever we go out to get from the public to consider a reinvestment, the more they know, the more they might be more likely to, sustain the agency. And therefore, we do need really solid communications that has improved even before we start asking them to give us more money, so that so more people know about it. JT, did you have something else to say?
Yeah, No, I was going to respond to that. So Amy and I have talked a lot about the need for additional personnel with particular skill sets to flesh out what the team is able to do. And she's been systematically adding people within the current year's fiscal budget. One's a science writer, one's the PR firm. We're talking about some other jobs that would be created either through FTEs down the road or limited hires tackling specific things, and potentially if we needed consultants. So we have a very robust dialogue on what she needs to make all of this happen. So it's and her office is right next to the president's office, Isabel. I don't know if you knew that. So you're prescient on that, and so we're constantly dealing with these issues, and we made in bringing Amy in to be somebody who would formulate a highly strategic approach. We're looking and have been in the process of upping our game across all aspects of communications, and we'll continue to do so. And it will get emphasis in terms of additional budgetary needs as we determine is necessary. So thank you for that point.
I do want to remind everyone that we do have a headcount cap. And so oftentimes we have to balance the admin that we're capped at, the headcount that we're capped at, and balance all of that, and find other mechanisms by which to perhaps achieve this, whether it's consultants or otherwise. So I just wanted to flag that. So in case, just as a reminder for those, and especially for new board members that might not be aware that there is a headcount cap.
Pat? Mute?
Yeah. Here I am. So Amy, the board is made up of most of the constituents that you have in your strategic plan. So is there any plan to utilize board members as you're developing stories to determine how those stories penetrate and resonate with specific groups? You have advocates, you have private sector, you have academics, you have researchers, you have physicians, you have those who have been steeped in the policy world, not legislators now, but have been in the policy world for a long time. So I'm wondering if there is a component there where early on it's sort of your own internal focus group, small sample size, so not great for analysis, but it would give you some sense about whether there's anything major going on in terms of how the story has been developed and modified for that group.
I think that's a really good idea. It had not occurred to me, but I think that's a fantastic idea. I would look to Scott for help in figuring out the right way to pull together those groups of board members, but that's terrific. I expect everyone on this call to sign right up. Thank you.
If no one's ever participated in a focus group, it's actually fun. It's actually quite interesting, and it's not a huge amount of time, especially given the way how you're going to deliver the story and the length of the stories. So it's a little unfair because we're all familiar to some degree with what's going on at CIRM, and you're going to have audiences that may not be familiar at all. So with a little bit of head start, but I think it might give you some clues early on.
I mean, I think for a starting point, yeah, you all know a little too much. You're all a little too smart. But I think for a place to start, and if I can't do the real focus group until next year, that's a great idea.
Yeah.
So Amy, I still think an untapped audience that one needs to know more and needs to engage more is the Latino community. They're 39% of the state of California, which means 16 million people, 83% of whom are Mexican, and most of them are English speaking. But I do think we need a bilingual approach as well, a very strong bilingual approach, because I think that there is, a $10 here and a $10 there and a vote yes to be gained from really giving this community a reason why they should know and care about, which is the the bottom line, typical communications message. Why should I care? Why should I read this? How does it impact me? And so I'm hoping that even as you strategize, you consider an effort to, really focus on that community bilingually, because there are a number of bilingual organizations, media organizations out there that you can start to outreach to. There's even the Los Angeles Times has its own group called La Onda. And so, but they do bilingual. So you can find those places tucked away in different parts of the state where I think it would be very helpful. So I think you really need to include that as part of your strategic plan. And that could be a model for how to reach out to the other communities of color and underrepresented, and even rural communities, because you'll get crossover in all of those.
Isabel, I totally agree. One of the things I didn't mention when I introduced the new PR firm, Forsmarsh, one of the things that really struck us about their proposal is that they included in their proposal a lot of Spanish language placements for other clients. And we have a dedicated person from their team who is bilingual and who focuses on Spanish-speaking media. So for the CCCEs, they reached out extensively to Spanish language organizations, including the Spanish-speaking portion of the LA Times. And several of them got back to us and said they weren't going to do a story right now. And you will understand this, because all we did was announce that we are going to be launching these CCCEs, right? They came back to us and said, great, let us know when they open. And they might want to follow a patient to their first clinical trial, or, do a more personal story about the CCC opening. And that's the response we got from several of the Spanish language publications. But I think we're going to see a long tail on this, and it will be more Spanish language.
You know what? I'm going to counter that with, at least, culturally, what is the cultural fit? And I think that if you understand the culture of each of our communities, you can better, once again, fit the story. And, I don't think an opening of a building is super exciting to a Latino. I think a story about a Latino who has an issue that needs to be addressed is what grabs people's attention. So I always remember the bubble baby.
Yeah, well, they want us to come back to them when we have a patient, when there is someone in the Latino community who's going to the clinic, and they can follow that patient and talk to them and maybe go to their appointment with them. That's what they're wanting us to come back to them with. And I think that'll be a great story.
I think even a greater discovery, and please, everybody, feel free to check in and give Amy story ideas from different communities. But I think an even better story is finding people in community who's, in fact, have children or an adult who has one of the issues that could use some stem cell, that shouldn't possibly be in a clinical trial, who could possibly be very important to discovery in the stem cell program. So, and then follow them into systems, right? But reaching out so that you're educating a community while you're pulling in a family, to me, is getting double and triple the payoff of that sort of story. But I love those beginning stories where they discover that there's something to give them hope. Remember? Awe?
I know. It's still in there.
I saw that. Well, I haven't seen Elena or Linda. You're hiding from us, but do you have any questions?
No, looks wonderful, actually. I have great confidence that we're going to enter a new era for the community.
Good. I'm glad you feel that way. I do too. Elena?
Yeah, thanks so much, Amy, for this presentation today. And it's been just, I think, since you were first introduced to CIRM, I felt a lot of optimism. So that's a good sign. Yeah, I don't think I have anything else specific to add today.
Okay, thanks. Landra, come on, you always have something to say. Leandra, no? I'm just asking.
I did not raise my hand, but I'm happy to say something if you're fishing for that.
So
I really appreciate the comments from Pat. In fact, in a prior meeting, I know I had raised the use of the board members. I think Isabel has raised it before as well. So I hope that that's all logged and we can talk about how to make that a reality because it makes sense. That's just kind of homegrown. It's right here in your backyard. And it makes a lot of sense to utilize us in a way. Not that I'm offering up the board, but I guess I kind of am. So I just wanted to lift that up. And also, I really do appreciate your slide with your music and how that translates over. I do appreciate the artistic notes in your presentation and what you're trying to convey. So nice work, Amy. Thank you.
Leandra, thank you for offering up your fellow board members to serve because that is what I hope for. Next week we're going to roll out a new, basically the CIRM story, a deck. And you'll see in the strategy that over the next couple of months, I'm working on a communication toolkit that will enable everyone on the board and staff or anyone else to speak about CIRM. So I'm hoping to enable everyone, and then I hope everyone takes me up on it.
Great. Last words, anything from Yale or Chris? Besides a hand clap for Yale.
No, I was raising my hand. Amy, I really appreciated your presentation, and I may have missed this, but one of my concerns for targeted communication are clinicians in the trenches. People who are going to have to be informed about these strategies and how they work. I'm thinking about nurses, primary care physicians, and I wasn't clear, are they in the plan somewhere? Because, I think as this rolls out and it's available, they're going to be, in some ways, the gatekeepers for this in terms of getting people to clinical trials. So I don't know how we've thought about that, and maybe you could comment on that.
I do have a comment, but Vito's waving his hand, so I think he has something to say on that point. Vito, do you want to respond, and then I'll respond?
Yeah, sure, I did. Every professional society in medicine and surgery of clinicians in the state of California, anesthesiologists, ophthalmologists, you just go down the list alphabetically, they all have an annual meeting. And for example, in January, I went with Bob Klein, the founder of CIRM, down to the annual meeting of the California neurosurgeons on the coast near Santa Cruz. And they gave him an award, but he had an opportunity to address all of these people. And I think that that's a wonderful idea. And I'll bet it would be relatively easy, and not just physicians, but for all the various nursing consortia. Ask them for 5 minutes at their annual meeting for a non-political, state-of-the-art, this is what's happening in regenerative medicine. And I bet you reach, I'm going to guess, especially if you add in county societies, maybe 10,000 thought leaders in various communities in every county in the state. Yeah, I have given some thought to that, haven't acted on that yet. But thanks, Chris. That's a great idea. And if I may, at the risk of extending this, Isabel, you and Amy had an idea about the first Latino going to one of these clinical trials and being followed by media. So Jacqueline and I had the honor yesterday of going to Baldwin Hills High School. It's a high school of 1,000 people, and I will wager that every single one of them speaks Spanish to the padres and abuelos when they go home. And we had a wonderful time, and Jacqueline did a great job in gaming with them on how to do advocacy. But at the end of that presentation, a young senior, a young woman, came up to me, a little teary-eyed, and asked about what was happening in regenerative medicine with respect to Duchenne's muscular dystrophy. Ironically, on the very day when that company's stock went up 300% for its advance in therapy that looks like it's going to get approved by the FDA. She had her 24-year-old brother has Duchenne's. He's not been treated for it really, except by his primary care physician, and had no idea of the existence of clinical trials. So I don't know, maybe I could, without disturbing HIPAA, reach out to that person, and that might be something, Amy, we could follow up on.
Yeah. Maria, I see your hand up, but I really want to jump in and respond to Chris. Do you mind if I do that quickly?
Oh, please, go ahead.
Okay, because Chris, I think you have a great point. We have thought of those audiences. They're not in the plan, mostly because it's already a very, very big plan. But I think they're critically important audiences. So in my mind, maybe they're not in my plan directly, but perhaps I deploy board members who happen to be nurses to go, so I think this is a place where we can really use board members as advocates. And then I also wanted to make the point that the CCCEs, as they get up and running, they are going to engage with primary care physicians and nurses and others in the healthcare community who will be directly working with patients. So I think it's just another opportunity to reach those audiences. Okay, thank you for that, Maria.
That's just what I was going to add, is that the CCCEs have physician engagement and outreach plans, and they're going to be coordinating with our alpha clinics who also do the same around messaging and all the rest. So there is a plan for that in sort of another area, but of course we'll be working really closely with Amy and her team to make sure that the messaging is consistent across all of our channels.
Yeah, Maria, I agree, because I think, Amy, no matter whether it's another team doing it, the job of the communications department is to know all things about all people. So that if you see an opportunity for a cross connection in communications, there it is, because you have that relationship and you know what's going on. So that's great. Did I get everybody? Yale just clapped, so that's it. Oh, Chris again, or is Chris?
Yeah, Isabel, if I could comment, I think Maria and Amy, seeing the training materials for nurses, primary care docs, advanced practice clinicians, whoever the audience is going to really be critical, because I think they're going to have to be leveled at the right level so people can understand the basics of this therapy. It's not common education, certainly in nursing school at this point in time. I'm less familiar what primary care docs get in terms of their level of education. But this is a complex area of science. And I'm hopeful that because I do remember reading the Alpha Clinic proposals for the educational outreach. And I'm looking forward to seeing those products, because I think it's going to be really, really important.
And somebody else? Okay. And to make things worse, Amy, I'm going to pile on. So you can dream about it. No, one of the things that I've always been concerned about is the disparate plans, if any, that our where we have our students, whether or not they're getting proper education and how to tell the world about what the heck they're doing. And when I was at San Jose State, had a wonderful opportunity to actually hone in on that issue and it appeared that there was one teacher or one professor who was focused on trying to train her kids to be media savvy, but it doesn't seem like it's kind of a model that can be shared throughout the universities and any and every place where we fund for students. So even consider a media training platform in the conferences, right? Including with the high school kids who learn to become much more savvy about, they're just saying, hey, don't keep it here. Take it out there. Put it on your, you're all guys are doing this all day. So share. But I think they have to be almost told that they can share, that they should share, right? So hopefully someone already has a wonderful plan, like maybe San Jose State, about how to train, and it could be just shared with and adopted by the different teams out there. But just to get it started and try to get that kind of uniform understanding across California educational institutions that, hey, you own this too, and this is part of what kids ought to know about and what they should be talking about.
I could not agree with you more. Back in the day, we used to do media training at the grantee meeting. So this was for the scientists. And at the last the trainee meeting, like that would be a perfect opportunity to provide these kids with media training and give them the toolkit that I've put together for all of you. I mean, I think that would be from your mouth to the education team's ears when planning that conference. It'd be great.
Cool. Yeah, I think it would be lovely. I think it would be exciting for them too, to sort of veer away from the science for half a minute. And how do I talk about the science, which amongst institutions and researchers is a huge sin. They don't even really know how to talk to the public about their fabulous work. So giving these kids that early, foot up would be really great. I love that. So
You
be
better
glad-
be, Isabel, you better be excluding me. I thought I get a pretty good job at your, with the cancer folks. On
I
a
thank
topic
you
that's
very
not
much.
cancer.
Thank you very much for showing up and being there. Thank you very much. Anything else? Because otherwise I'm going to ask Claudette to check out there and see if anybody in the public can give them the rule, whether or not they have a minute to talk or 2 minutes to talk. Or I'm not sure what the rule is.
We usually get 3 minutes, but there are no hands raised, Isabel.
Oh, and the most important conversation you can have this end of the year. There's no public to hear it. Okay. Anybody else? Anything? Who's going to direct me? Scott, is there anything else we need to talk about at this meeting?
There is not. We are ready to adjourn when you are ready.
Okay. Amy, any last words, or are you all time for cocktails?
Katie and I have another meeting. I have one last word, and this has been something I've been trying to say since someone brought up finances. I see Jen Lewis is on this call, and I just want to say I've been hugely supported by our finance team. I took this job after the budget had been written, but I'm really being supported by the finance team. They are working hard to figure out how to get me what I need, and I'm just so grateful for that. And then I plan to ask for a whole bunch of money next year, so hopefully they keep me.
Great. Well, thank you to the finance team for its commitment. Okay, well then I say that let's adjourn and check you next Thursday at our regular meeting. And thank you all for joining us.
Thank you, everyone.
Thank you. Bye-bye.